Good afternoon, everyone. Welcome to the Saskatchewan Retirees Association webcast. This is Randy Dove. I'm the president of the SRA, and we certainly are pleased to have you join us here this afternoon. We have about 57 people logged in to join us for the afternoon. We have a really interesting, exciting topic to talk about. One of those topics that we need to be more thoughtful about these days as all the questions around social isolation and loneliness is certainly something that's high on people's agendas these days. As we start, we want to acknowledge that the land where this webcast originates is Treaty 4 territory, traditional territory of Indigenous peoples, and the homeland of the Métis. The SRA's mandate is to provide services and support to meeting the needs of retired and retiring public sector employees and retirees in Saskatchewan. We're approaching 4,000 members now, and also now have over 90 organizational members supporting our organization. We continue to attract new members and certainly appreciate your support and confidence in the association as we continue to grow and continue to respond to your needs and interests. Our concept of strength together really means working with you and on your behalf through our board and through our committees to make sure that we are in touch with you and supporting your interests. When we surveyed members in 2022 to better understand your interests, we received feedback from about 1,600 members, all of you indicating that you are interested in these kind of sessions, and that so as a result of that, we've been offering these webinars over last year and into this year to bring topics forward that we believe are important to you and that you've told us you're interested in hearing about. And so we will continue to do this series, and this is a continuation of that series that started last year. So we're happy to bring this webcast to you and certainly respond to your questions. Just a few instructions as we get into the afternoon. If you have a question on your screen, there's an Ask Questions box on the right of your screen. And so if you've got a question there, if you could put it in there, and it will be collected, and that then later on we'll ask our special guest or ourselves to respond to those questions as we go on. We will be identifying members by first name only. That's an indication back to you that we've got your question and that we are providing that. Questions will be grouped together if there are similar questions. So your specific question could be grouped in with someone else's so that we can get through as many questions as possible. And that this webcast will also be posted later on YouTube for your viewing, or for others that couldn't be with us today. We've had a number of people ask that question if they couldn't make it today, but they'd like to be able to view the content at a later date. So it will go up on YouTube, and we will also put it on the Saskatchewan Retirees website so that you can find it there too, or find the link there that takes you to YouTube to do that. I want to introduce Lyle Fluter. Lyle will be handling the questions. And Lyle is a member of our Membership and Communications Committee, and he's helping us through that process today. So welcome, Lyle, and thank you for helping us out. If you have any technical difficulties through the telecast or the webcast, if you click the tech support button on the top right of your screen, you should be able to get some support from our supporters through VoiceWorks and Webcast Canada if you've got issues there. So I want to move to just a quick kind of intro, some context before we go to our guest speaker. And that's a bit of information about sort of the current situation in Saskatchewan related to where we are as far as our population and our direction here. And so you should be looking at a slide now called the Saskatchewan Scene. There's been a lot of talk across Canada about the so-called silver tsunami. And this is all about the whole question of an aging population and that. And so in Saskatchewan, currently about 17% of our population is made up of older adults. And the forecast is that it could be as high as 25% by 2035, which when you think about it, it's not very far away anymore. And that, so over 300,000 people are expected in Saskatchewan to be over the age of 65 with just within another 11 years and that. So also, it's always important, I think, in these presentations, to remind all of us that while we have a so-called aging population, we also have a tremendous amount of contribution coming from older adults to the economy. Surveys that we've done indicated that of our aging population, of our seniors, so-called senior tsunami, that 71% of those individuals are still involved in some form of volunteering, and about 23% are doing caregiving, whether that be for a spouse or a parent or a child or a grandchild or a friend or a family member or the like. And so it's an important piece of the economy that's around us. And 53% of our older adults in this province said they are still actively working in a paid job. And so when we did the math on this at that time, when we did this survey, if you rolled those numbers together and all we did was apply the minimum wage to that, it's almost $1 billion in economic activity. So there's a huge contribution being made by older adults in Saskatchewan and across Canada. This is not unique to Saskatchewan, these numbers, but that's a small snapshot here. I think you'll know that the Saskatchewan Retirees Association is also associated with the Saskatchewan Seniors Mechanism. And through the Seniors Mechanism, we have been actively providing both financial and volunteer support to the whole direction of home supports and trying to help people age in place, stay at home, and live their lives as best they can with some support from additional people. This is obviously important when we get into the question of social isolation and loneliness, because the flip side, of course, is if you stay at home, is you can have a potential to be somewhat isolated from what's going on in the world. And so I think that that's just an important, a bit of an important piece of information to just highlight for you. I think from there, I will move forward then and move towards introduction of our guest speaker. And so at this stage, I would like to introduce Harold Hug. Harold is the Vice President of the SRA, and Harold will introduce our guest speaker. So over to you, Harold, please.
Thank you. Good afternoon. As Randy mentioned, I'm Harold Hug. I'm Vice President and Chair of the Group Benefits Committee for SRA. And it really is my great pleasure today to introduce our guest speaker, Natalie Iciaszczyk. Natalie is a research program manager at the National Institute on Aging, a public policy and research center based at Toronto Metropolitan University, formerly Ryerson University, focused on the realities of Canada's aging population. She holds a Master's of Arts in Sociology and a law degree from Western University and is passionate about using her research background and training to help shape policy in response to Canada's aging population. We're very pleased to have Natalie with us here today. Natalie's presentation, titled Understanding Social Isolation and Loneliness Among Older Canadians. Natalie, thanks so much for being with us, and I turn it over to you.
Thank you so much for having me. And thank you for the wonderful introduction, and really looking forward to having everyone join us today. So I'm very excited to be here this afternoon on behalf of the NIA team to share a little bit about our work on social isolation and loneliness in older Canadians, and specifically our more recent research using the NIA's very own Aging in Canada survey, through which we have been able to collect data to get a better sense of how these issues are impacting older adults in the country. So while the NIA has published other work on social isolation and loneliness in the past, including a policy white paper where we did a really comprehensive review of the state of affairs in Canada. I will specifically be covering the findings of a survey report we published last fall titled Understanding the Factors Driving the Epidemic of Social Isolation and Loneliness Among Older Canadians, as well as some subsequent analyses we have done on the topic, all of which can be found on the NIA's website. But before we dive into the findings of our research, I'll first say a little bit about what it is exactly we are referring to when we discuss both social isolation and loneliness, why these issues are increasingly recognized as having significant implications for the health and well-being of Canadians and older Canadians in particular, and what motivated the NIA to build in a specific focus on these issues into the survey that we run annually. So one of the reasons that we at the NIA have increasingly turned our focus to doing work on social isolation and loneliness is to help bring consensus around the meaning of these concepts. So in the past, there has been a tendency for media, governments, and even academic literature to use the term social isolation and loneliness interchangeably, which has made it really hard to get a true sense of the problem in the Canadian context and to appreciate the unique aspects of these interrelated but distinct concepts. So for our purposes, when it comes to social isolation, we define it as a measurable lack of social contact. It has to do with the objective dimension of one's social network and arises when a person has a quantitatively diminished network or is physically separated or excluded from their network. On the other hand, unlike social isolation, which is really mainly an external experience, loneliness is an internal subjective experience that is felt and arises when there's some sort of deficit in a person's social relationships, whether those relationships are lacking in either quality or quantity relative to what they desire. And so they really are distinct experiences, but despite being different, there are also similarities in the predisposing factors and outcomes related to both of these issues, which suggests that there are likely commonalities among the types of interventions that can be used to target and address them. All right, so now let's turn to what we know about both of these issues based on existing research and how they impact older Canadians. So firstly, older adults can face a higher risk of experiencing social isolation and loneliness for many different reasons, most of which are outside of their individual control and have to do with the circumstances surrounding the aging process. So older adults face the risk of having diminished social networks and less frequent social interactions as they age, which can lead to social isolation and feelings of loneliness, given that the aging process is often characterized by transitional life events such as retirement, widowhood, the death of a friend, or even relocation. And research has also identified a number of risk factors that make it more likely for older adults to experience social isolation and loneliness. So here you'll see a list of examples of some of the potential factors, which can be risks for social isolation and loneliness. And they include things such as lacking access to adequate transportation, which can be especially challenging in rural populations where loss of one's driving ability can be more often associated with social isolation. Other considerations include the growing geographic mobility of family members in recent decades, which make it more likely for older adults to be separated from their families than in past generations, or a lack of opportunities to meet people due to one's geographic location. Specific sociodemographic characteristics have also been linked to increased social isolation and loneliness, such as immigration status, for example, with loneliness found to be more common among older members of immigrant populations, where the language and culture in the destination country differ significantly from one's country of origin. And in terms of the consequences of social isolation and loneliness, both have consistently been identified as detrimental to a person's overall health and well-being. For example, studies have shown that both social isolation and loneliness are associated with numerous negative health behaviors, including a lack of physical activity, smoking, drinking, as well as a range of poor health outcomes, including cardiovascular disease, dementia, mood disorders, depression, and cognitive decline. But perhaps most concerning is the fact that both social isolation and loneliness have been identified as significant independent predictors of premature mortality. In fact, one prominent analysis even found that the health effects of prolonged social isolation are equivalent to smoking 15 cigarettes a day or excessively consuming alcohol. Studies have also shown that both social isolation and loneliness have significant implications on the mental health of older adults and can increase the risk of problems such as dementia, clinical anxiety, depression, and suicidal ideation. In fact, lacking a supportive network has been found to increase the risk of dementia and cognitive decline among older adults by 60%. And another type of consequence that research has identified is that social isolation and loneliness among older adults is that social isolation and loneliness may also lead them to engage with the healthcare system more frequently, which in turn contributes to additional healthcare costs. So, for example, the negative health consequences of social isolation among older adults may contribute to increased utilization of the healthcare system in general. But even when accounting for comorbidities, social isolation has been associated with increased hospitalizations and emergency department visits. And then on top of that, research has also shown that older persons who are socially isolated are then also at higher risk of being readmitted to the hospital. Similarly, loneliness may prompt socially isolated people to seek medical assistance as a means of social interaction, with studies showing that loneliness is associated with increased physician visits, an increased use of outpatient services, and an increased use of primary care services when accounting for overall health and health behaviors. So, for example, in one Canadian study, loneliness was associated with more frequent use of emergency medical services among older adults, with the findings showing that 49% of those who called EMS more than 5 times per year self-identified as being lonely, while 37% rated themselves as intensely socially lonely. Okay, now that we know a little bit about these issues and some of the ways in which they can impact older adults, that brings us to the question of to what extent are social isolation and loneliness affecting older Canadians? And that question is another one of the factors that has motivated the NIA to do work on this topic, including through our annual survey on aging. So before launching our survey, it was quite difficult to understand the full scope of these issues in the Canadian context, given that we didn't have any consistent and reliable data on both social isolation and loneliness among older adults. Canadian data on these issues came from a variety of population-based surveys, which were collected at various points in time and used diverse measures, making it quite difficult to compare findings both across sources and periods of time. And while existing data did seem to confirm or at least suggest that both social isolation and loneliness were a problem being experienced by older adults in Canada, estimates on the prevalence did vary quite a bit. So, for example, one of the more recent sources of data on the issue came from the Angus Reid Institute, which found that in 2019, 62% of Canadian adults said that they would like to spend more time with their friends and family, and that only 14% described their social lives as very good. That same survey also found that a third of Canadians weren't certain that they had friends or family they could count on if faced with a financial emergency. And 1 in 5 weren't certain that they would have someone to count on for emotional support if faced with a personal crisis. Other available research on social isolation and specifically estimated that about 1 in 6 older adults in Canada were socially isolated, and that social isolation levels were especially high for those living in long-term care homes. And in terms of loneliness, estimates in the Canadian population at the time ranged from anywhere from 20 to 80%. And when it comes to looking at both social isolation and loneliness together, estimates suggested that around a quarter of Canadian adults were experiencing both social isolation and loneliness. And so while existing estimates suggested that both social isolation and loneliness were significant issues affecting our population, there weren't any clear and recent estimates among older adults specifically, or sources through which we would be able to consistently track these issues when looking to the future. So, for example, we found that only Saskatchewan intended to start collecting data on these issues among its senior population, but we couldn't find any source of data doing the same elsewhere or on a national scale, which was a major gap, especially when looking to see how these issues would evolve as our population continues to age. And so at the NIA, we decided to start collecting our own data to track the extent of these issues among older adults in Canada, as well as what the characteristics that are both contributing and protecting individuals from their consequences. And so we were able to do this at the NIA because we launched a 10-year research program through which we developed a new annual survey on aging in Canada to track Canadians' perspectives and experiences on a range of issues related to aging, including social isolation and loneliness, as the population continues to get older. And through this program, we launched our first inaugural survey in 2022. And it provided the baseline data against which we will make key comparisons with our survey in the years to come. In terms of methodology, data collection for the NIA's first survey occurred online between July 5th and August 7th, with a large non-probability sample of almost 6,000 individuals 50 and older, living primarily in the community across Canada's 10 provinces. And our sample was stratified by 5-year age cohorts to include significant subsamples of respondents across different ages, paying special attention to ensure that we can include a good number of Canadians in the oldest age cohorts of 80 and above, who tend to be harder to reach through online surveys. And we also established quotas to ensure that we had good representation by other characteristics such as region, community size, gender, and education. Okay, and in terms of how the measures we use to capture social isolation and loneliness, the NIA survey employs two of the most widely known comprehensive measures that have been validated, but which can also be easily incorporated into a survey such as ours, given that they have been specifically designed with ease of administration in mind. And for our measure of social isolation, we use the 6-item Lubin Social Network Scale, which assesses the number, closeness, and frequency of important social contacts a person has with both family and friends. Scores on the scale range from 0 to 30, with higher scores indicating stronger networks and lower scores indicating social isolation. And a score of 12 has been identified as the key cutoff point on the scale, with anything below 12 suggesting that a person is at risk of social isolation. In terms of loneliness, we rely on the Hughes 3-item loneliness scale, which asks about the frequency of feeling left out, isolated, and that companionship is lacking. And possible scores on that scale range from 3 to 9, with higher scores indicating greater levels of loneliness. And for our purposes, those who score 3 are considered to be not lonely, while those who score between 4 and 6 are somewhat lonely, and those who score between 7 and 9 are very lonely. All right, and now for the findings on social isolation and loneliness that emerged from the NIA's first survey in 2022. So overall, we found that while many Canadians 50 and older are doing somewhat well in terms of their social circumstances, a significant portion are socially isolated or at least at risk of social isolation and experiencing loneliness. So in terms of social isolation, we found that most Canadians 50 and older reported that they had a network of family and friends that they could count on, but 41% were classified as at risk of social isolation, meaning that they had scored below 12 on the Lubin Social Network Scale. And in terms of loneliness, our survey found that 58% of Canadians 50 and older were experiencing loneliness in 2022, with most being only somewhat lonely, but about 1 in 5 found to be very lonely based on the Hughes loneliness scale. We then also looked at differences across age groups by comparing Canadians between the ages of 50 and 64, 65 and 79, and 80 and older. And somewhat surprisingly, given everything that we know from other existing research and the many life events and changes that can occur later in life, we found levels of both social isolation and loneliness to decrease with age. So compared to their younger counterparts, the oldest Canadians, 80 and older, were the least likely to be at risk of social isolation and report feelings of loneliness. On the other hand, of the 3 different age groups we examined, Canadians 50 to 64 were the most likely to report experiencing both social isolation and loneliness. 2 other characteristics that emerged as being especially significant in our research in terms of leading to very large differences in levels of social isolation and loneliness and disparities within the population were health status and income security. So when considering the role of health status, we found that Canadians 50 and older who reported having fair or poor health were especially vulnerable and much more likely to be at risk of social isolation or to experience loneliness, especially when compared to those who said their health was very good or excellent. So in many cases, the proportion experiencing isolation or loneliness was almost 2 or even 3 times as high among those with fair or poor health as among those who said that their health was excellent or very good. So for example, while 51% of those with fair or poor health were found to be at risk of social isolation, the share was only 33% among those with excellent or very good health. And even larger differences were found when looking at loneliness, where 34% of those with fair or poor health were found to be very lonely, compared to only 10% of those with excellent or good health, very good health. Similarly, we found income security to be an incredibly important characteristic that led to very large differences in levels of social isolation and loneliness among older Canadians, with those who reported the lowest levels of income security especially vulnerable to experiencing these issues. So throughout our survey, we asked Canadians about their overall financial well-being, with a question on income adequacy, which asked respondents to rate their overall household income. And we found that those with the most income security, who said that their household income was not enough for them and that they were struggling, were twice as likely to be at risk of social isolation as those with the highest levels of income security, who said that their income was good enough to build savings from it. So in that case, the proportion at risk of social isolation was 62% among those struggling financially, compared to only 31% among those who said that their good income was good enough for them. And experiences of loneliness were also considerably higher for lower income Canadians 50 and older. So for instance, 56% of those who said that their household income is not enough for them and that they are struggling were very lonely, while the share was only 9% among those who described their income as good enough. And through our survey, we also looked at the role of family ties, and we found that they helped prevent both social isolation and loneliness among older adults. So one aspect of family ties that we looked at in our research was partnership status, to see whether those who were married or who had a partner reported less social isolation and loneliness than those without a partner, whether that be because they were single, widowed, or divorced. And overall, we found that to be the case, with individuals with partners appearing to be especially protected from experiencing social isolation or feelings of loneliness. We then also looked at whether children helped reduce experiences of social isolation and loneliness among Canadians 50 and older. And we also found that to be the case, with those who reported having children also reporting lower levels of social isolation and loneliness than those without children. And finally, our survey report on social isolation and loneliness that we published at the NIA also featured a number of other characteristics known to potentially be important when it comes to social isolation and loneliness, some of which did lead to group differences as expected, while others, somewhat surprisingly, did not. So, for example, while we would have expected there to be significant gender differences based on existing literature, in our case, we did not find there to be very large or meaningful differences in levels of social isolation and loneliness between men and women. We then also looked at other dimensions of socioeconomic status, such as education and employment. And while we found higher levels of education to protect older Canadians from social isolation and loneliness, we did not find very large differences based on employment status when comparing those who were still working and those who were not. And when we considered whether living independently in one's own home played a role, we found that Canadians who still lived independently in their own homes had less social isolation and loneliness than those no longer living in their own homes, but rather in the home of someone else, such as a family member or friend. And finally, we did also look at the role of immigration status, and somewhat unexpectedly, we did find there to be few differences in levels of social isolation and loneliness between those born in Canada and those born elsewhere. But since releasing our survey report looking at levels of social isolation and loneliness using the NIA's first annual survey, we have completed a second round of data collection in 2023 that provided additional subsequent findings on these issues that are worth highlighting for you all today. So, using the NIA's second survey, which again relied on a large sample of almost 6,000 Canadians, we found levels of social isolation and loneliness among Canadians 50 and older who have stayed consistently the same, with 4 in 10 to be at risk of social isolation and nearly 60% experiencing feelings of loneliness in 2023. However, using the 2023 data, we were also able to combine responses to the questions on both social isolation and loneliness to create a single integrated measure to better understand the overall strength of social networks among Canadians 50 and older. And when we did so, what emerged out of the 2023 survey is that about 1 in 3 Canadians 50 and older have weak social networks, and that they experience both social isolation and loneliness, with 12% found to have very weak social networks, while 22% were found to have somewhat weak networks. But overall, when looking at the population 50 and older, we did find that Canadians are pretty evenly split in that 1/3 have strong networks, 1/3 fall somewhere in the middle, and then 1/3 have weak networks. However, when we did look at differences across age groups, we found that weak networks were most prevalent among the youngest cohort of Canadians 50 to 64 years, while strong networks were most common among those 80 and older. And so overall, while social isolation and loneliness do remain real problems in Canadian society, and including for a growing number of older adults, these findings suggest that the oldest Canadians, 80 and older, who are still living in their communities, seem to have maintained their relationships or established new meaningful connections while aging, leading to less social isolation and loneliness. We then also looked at social network strength across both health status and income security. Just given the very large discrepancies that we previously had seen in levels of both social isolation and loneliness across these characteristics. And consistent with those findings, when social isolation and loneliness were combined and looked at together, we again found that Canadians who were most vulnerable in terms of their health and income were considerably more likely to have weak networks than those with better health and incomes. In both cases of health status and income security, we found that those who were most vulnerable were around 3 times as likely to have weak networks as those with the best health and incomes. And so now, given these findings, which do confirm that social isolation and loneliness are problems affecting at least 1/3 of our population 50 and older, if not more, this brings us to what exactly can be done to help reduce levels of social isolation and loneliness among our growing population of older adults. So within Canada, there are a number of great examples of interventions and programs currently in place to help address social isolation and loneliness among older adults, with just a few examples listed here on the slide. Additional information on many of these programs can be found on the NIA's website and in our white paper on social isolation and loneliness. So I won't go into too much detail just now, but one of the neat examples is, for example, what the government of British Columbia is doing to support improved transportation services for seniors, specifically in order to help them maintain meaningful social connections and independence in their local communities. And it is doing so by funding community organizations throughout BC to purchase buses and vans and make other improvements to existing transportation services for seniors to help them age in place, stay physically active, and stay socially engaged. Another government-led initiative are the Ontario Seniors Active Living Centres. So as part of its senior strategy, the Ontario government has distributed funding for over 300 seniors active living centres across the province. And these centres offer a range of activities for seniors in the community, including exercise clubs, workshops, and social gatherings. In addition, at the community level, there are also many excellent programs and very helpful interventions being offered by existing organizations that help to address both social isolation and loneliness. So one example is Saskatchewan's Age-Friendly Saskatchewan initiative, which has introduced age-friendly community recognition programs to recognize communities that are undertaking activities or creating programs to be more inclusive of older adults and help them remain engaged and involved members of their communities. And while this program is possible via collaborations with governments at all levels, because it operates under the oversight of the Saskatchewan Seniors Mechanism, it's a really great example of how community-based initiatives can really take the lead in implementing the sorts of changes we need to support the social inclusion of the growing number of older adults in Canada. And another good example is the Good Companion Senior Centre Without Walls program, which offers free telephone-based group activities for older adults 55 and older, as well as adults with disabilities living in Ottawa and surrounding rural areas. And this organization has had great success in helping its participants access meaningful information and programs that they otherwise would not have known about or been able to access. But while there are many examples of government-led and community-based initiatives that help combat social isolation and loneliness in Canada, there are a few sustainable long-term strategies that have been adopted to address these issues, despite recommendations from the federal government's National Senior Council to do so over a decade ago in 2013. Yet, as the findings I covered today reveal, social isolation and loneliness are serious issues that today already impact a significant share of Canada's older population. And that means that as the population continues to get older in the coming decades, the number of isolated or lonely older adults will likely increase, meaning that without concrete and immediate action, we can really expect both the individual and societal consequences of loneliness and social isolation to become more severe in Canada. And so that brings us to what concrete steps can be taken to help address the realities and challenges of social isolation and loneliness in Canada. And the NIA has outlined a few key considerations that I will quickly share today. So firstly, the NIA has previously recommended and continues to advocate for the development of a national senior strategy to address social isolation and loneliness among Canada's aging population. So Canada could follow the lead of other countries that have implemented national strategies and learn from their successful examples, with the federal government taking a central leadership role and supporting coordination between the provinces, territories, and municipalities. In addition, Canada should continue to invest in research and the evaluation of programs and interventions that can help establish sustainable best practices to better address social isolation and loneliness. So while there has been significant research in the field, most has focused on identifying the risk factors for social isolation and loneliness, as well as understanding their consequences, rather rather than looking at the effectiveness of the interventions or how they operate on a long-term basis. So for this reason, there should really be a focus on supporting research that evaluates existing potential interventions and in particular their long-term benefits. Finally, in addition to developing a national strategy and improving the evidence base on interventions, in the more immediate future, emerging promising practices that have the potential to seriously limit the degree to which older Canadians experience social isolation and loneliness should be further considered, developed, and even leveraged. So examples of promising practices that could be further considered include age-friendly communities, social prescribing programs, and age tech solutions to combat social isolation and loneliness. And that concludes my presentation. Thank you very much.
Okay, thank you, Natalie. Thank you so much for that, for your comments and your insights. That's a tremendous amount of research and survey work that the National Institute on Aging has taken on. It's interesting to me, just from our connections here through the SRA and through this seniors mechanism, to see some of the parallels that you've drawn across the country and that. And so one thing in your data that I would say personally surprised me a little bit was the indication that our oldest Canadians are maybe less socially isolated than those that are more in the 50 to 65 range. I mean, and the connections with health, income, family, and independent living are things that we have talked about before here, as far as things that need attention in Saskatchewan through our own research and through research the SRA has supported with the SAS Seniors mechanism. So I think it's very helpful to hear additional information that is similar. There has been a lot of discussion in this province about the need for a strategy around older adults, and including the potential of like a stronger amount of activity and a stronger amount of attention to the issues of older adults from our provincial government and that. And so these things just fit in very nicely. So once again, thank you very much for your presentation.
Thank you for having me. And, I will just quickly comment, Randy, the finding on the Canadians aging older doing the best in terms of their social isolation and loneliness was shocking to us at first, but was something that we actually found like across the board on all issues related to aging. In our survey, those 80 and older tend to report the best outcomes, and that's what we're seeing so far.
Wow, that's a really different concept. I mean, it just
Absolutely.
To me, it's not what I would have expected.
No, but it's a very promising finding in a lot of ways, and something that we're excited to explore in the coming years.
Yeah. Okay, so we're going to open it now to our contributors that are online with us, and so hopefully there's been some questions come in as you've been speaking, and if not, there's certainly time. If you've got a question now that you've heard the presentation, you can certainly go to the question box, put a question in. Lyle will get it, and we can feed it back into Natalie, or it could be Harold or myself end up being asked to answer a question, depending what it is. But I'll turn it over to you, Lyle, and you can bring those questions forward, please.
All right. First question is from Gwendolyn. Our question is, have you ever considered the impact of a grief on isolation, loss of a spouse or partner, child, etc.? And second part of the question, have you consulted with the Canadian Grief Alliance to compare loneliness?
So thank you so much for the question. I think in terms of incorporating resources related to grief is an exceptionally important angle to addressing this issue, especially when looking at programs and resources available at the more local level that older adults can have access to quite easily. So yeah, completely agree that it's super important, but we have not actually compared any data that they might have on loneliness, but very happy to reach out to see whether we have similarities or differences in our numbers.
Okay, thank you. One of our questions, what's the difference did the study find between urban and rural communities?
So you know what? That was another characteristic that we did consider. It's not featured in our report just because we couldn't write another 100-page paper on the issue. But what was so surprising, because again, this goes against what we would have expected and what some of the research shows, is that we found very few differences in terms of urban areas and rural areas, and then even middle-sized regions. So across the board, levels of both social isolation and loneliness were quite consistent. But then what we found, in addition to that, which kind of supports that finding, is that we also found very few differences regionally across the country. So whether it was British Columbia or Atlantic Canada, the number for social isolation hovered around 40%, and then same thing with loneliness, around 60%.
Next question is from Jean. Are there questions being asked regarding groups who are identified as likely to be discriminated against, such as LGBTQs, etc., on the survey?
Absolutely. So that's a great question. Thank you so much for asking it. And so yeah, we do do our best to incorporate as many sociodemographic characteristics and groups that we know could be especially vulnerable to these issues. So we haven't done specific analyses comparing the experiences of LGBTQ folks just yet, because that merits its own analysis and report. It is something that we hope to consider in the future, because they are currently being sampled in our survey, but we're also thinking about potentially expanding that sample base 1 year so that we have very good and adequate representation before publishing survey results on their experiences.
Okay, thanks. From Kathy, does Saskatchewan have any grants for people who want to start classes or activities for seniors? I'm not sure, Randy or Harold, if you're aware of that. We can.
With the loss of the Center for Seniors at the University of Regina, the university itself has started to pick up the actual classes that were offered through continuing education there. And so I think you will see that come back to life, likely starting in the fall of this year, for older adults to continue to participate and to continue to expand their knowledge or just personal interest type things. But in the meantime, that has been essentially been a loss to individuals because of the cuts made by the university.
Thank you. Betty asks a question. Could you expound on how you dealt with inclusion of older seniors who do not have access to technology or computers?
So that is one of the shortcomings of our survey that we acknowledge, is that currently it is an online survey, which means that by default, there will be certain groups that aren't targeted or missed or represented to the extent that we would like. Currently, the measures that we take is ensuring that we do oversample folks 80 and older who tend to not answer online surveys or tend to be a little bit harder to reach through online surveys. And then our partners at the Environics Institute, with whom we have collaborated on the development of this survey, seem to have a pretty good sample base that they rely on for a lot of their research, which is where we draw our sample to ensure that it is representative. And then we do also weigh all of our data so that it's representative by the census data. But ultimately, yeah, that is a shortcoming, that currently we are only collecting data via online surveys. And that's something that we're also looking to see if we can expand upon in the future.
One of our questions that I've always thought of with everybody I know, what are your top tips to overcome or avoid loneliness? So
honestly, when it comes to loneliness, I think given just the discussion today and how these two concepts differ, especially when comparing loneliness to social isolation, I think the first step is to really be honest with yourself and your feelings. So I think, what some individuals expect of their social circumstances won't align with what someone else expects. And therefore, loneliness is really a personalized experience. And then once, if you have identified that those feelings are potentially there or maybe creeping up, I would really suggest seeing what types of resources are available in your communities that can be quite easily accessible. So whether that be a senior center without walls or other ways to stay in touch with folks in the community and to remain engaged, particularly as if going through these transitional life events that happen later in life.
Okay. I got a question from Gail. Do you feel that the increased loneliness and isolation of those 50 to 64 could be due to the changes encountered when newly retired, or for those still working who have experienced ageism at work?
I think that's definitely a possibility. And I think, a very interesting consideration. Interestingly, the same way that those 80 and older tend to report the best perspectives and experiences in our survey, we found that those 50 to 64 tended to have the most grim outlooks on things, or a negative perspective on aging and retirement, and are really quite concerned about their experiences. But I think the point made about work and ageism is definitely a valid one that we could consider in the future, just given I know in our first iteration of the survey, we did see that the workplace was the setting where those 50 to 64 were most likely to experience ageism. We also saw that those 50 to 64 were slightly more likely to experience social isolation and loneliness if they were working than those who weren't, I believe. So there's definitely something potentially there that would merit further analyses on our part.
Okay, thank you. Ken has a question. Have your findings been shared with appropriate ministries of federal and provincial governments? If so, what is their reactions?
That is 100%, the goal through this work is that we want to get the attention of the folks who can, make changes and implement policies and programs to support our aging population, with now an evidence base to support some of those changes. So I know that through our organization, whenever we launch one of these reports, we disseminate it to a very large mailing list of stakeholders, including individuals in government, but then we also do a lot of outreach, such as today's webinar or specific events, to get the word out there and get their attention. So ideally, they've seen it, and if not, hopefully soon.
Thank you. No other questions on the from our registrars yet, but I'll ask a couple more here. Are there ways that technology could be utilized to better connect seniors with their loved ones, friends, and support networks?
Yeah, absolutely. I think that technology is definitely one way that we can consider improving these experiences among older adults, especially as a promising practice, as I mentioned in my presentation. So I think that there are already certain types of technology that are being developed and created to facilitate social isolation and loneliness, or facilitate social inclusion and prevent social isolation and loneliness. So one example is using tech to create safe spaces specifically tailored for connections among older adults. So there's one example called Intro that's in our report, which is an online social platform. And it's sort of a hub where individuals 50 and older can meet and discuss amongst themselves. There's another similar example, which is called FamilyNet, I believe. Yes, FamilyNet. And it describes itself as a user-friendly communication and private network application that is aimed at supporting older adults and their families and caregiving organizations. So I think online platforms specifically designed for enabling communication among older adults are just one way of incorporating tech, but there is a host of different types of resources currently being developed. Of course, one thing that is still needed in that case is research and evidence on whether they really are effective. Do they work just as well as face-to-face interaction? These are all things that we're not really sure of just yet.
Well, thank you. Question that I always near and dear to my heart is, what social activities or programs do you think could be initiated in communities that could be specifically tailored for seniors?
So, I think in that case, it's about making things as accessible while enjoyable as possible, but also an activity that gives folks the chance to connect and chat amongst themselves while doing the activity. So I think very often there are initiatives that bring a group together, but they don't really have time devoted to spending socializing amongst themselves. So things that come to mind are things like bingo, art classes, volunteering. I think especially once retirement is on the horizon, finding ways to still remain engaged with others and do meaningful work is a great way to build a new network of individuals with similar interests and mindset as yourself.
And no other questions on the thing. The question from ours is, what strategies or planning would you suggest that could maybe be initiated to help seniors build and maintain meaningful relationships in their communities?
So I would bring that right back to the previous question in terms of definitely being proactive. So if you know that retirement is on the horizon and suddenly you will go from seeing a big group of people on a day-to-day basis in the office to being at home, planning ahead of time, finding organizations and groups in which you can be involved locally, whether that be a few days a week or just one day, but being proactive in terms of finding ways to develop new networks, maintain existing networks. I think, again, looking at ways to incorporate communication amongst existing family members and friends, even if that means having very different geographic locations. So using some of these technologies that are currently in place, but overall being proactive is what I would say.
Yeah, thank you. And the other question is, what additional problems may develop that can be attributed to sustained social isolation?
So I think, bringing it back to some of the consequences I touched on in my presentation, the negative health effects and the negative effects on mental health and overall well-being of both social isolation and loneliness are quite concerning. So if you think back to the finding that prolonged social isolation has the equivalent effect of smoking 15 cigarettes or heavy alcohol consumption, that's a very scary statistic, and I think really highlights the gravity of these issues and why we really should be proactive in trying to prevent their consequences, and if they are in place, then how we can best alleviate them. And so I think when thinking about what can be done long term, it's really about realizing that while they stem from a social stance, they have very concrete health and mental health effects.
Oh, thank you. My comment on that is when I was part of the Alzheimer's Society, they stated if you do 60 hours of volunteer work, you'll never get Alzheimer's. So this proves that if you keep active, your health will keep active.
Yeah.
So got another couple questions came in from Marie. Has the residual effect of pandemic affected 50 to 65 years of age group, given more folks are working from home these days?
That's definitely a possibility, one that I suspect. There's at least some sort of role being played by the pandemic there. Unfortunately, we can't answer that concretely just because we don't have data comparing, levels of social isolation and loneliness from before the pandemic and now.
Okay. Evangeline, what kind of technical help can seniors who live alone purchase and from hours without anyone finding? Sorry, it was misspelled here. I'll reread it. What kind of technical help can seniors who are living alone purchase for themselves and hours alone finding somehow to help them out? It was misspelled. I'm ad-libbing here. So
did you say age tech at the beginning?
Was what kind of technical help can seniors who are living alone purchase from somewhere and hours of finding themselves alone, right?
So I think the unfortunate reality there is that we would hope that this isn't something that seniors have to purchase, but rather is something that we can make available to seniors more broadly across Canada. So when looking at some of the international examples that have really done a good job of being proactive in addressing social isolation and loneliness, there are countries that do yearly checkups on the at-risk populations. And then once they reach a certain age, all older adults get a yearly checkup just to see how social circumstances are, how are they doing, how is their health, and then if deemed to be at risk, then they are put in contact with resources and initiatives in the region to help them prevent the effects of social isolation and loneliness. And that would be excellent and something that we would advocate for quite strongly as an option to have in Canada.
Okay. I'll delay for a couple minutes in case somebody else has additional questions.
Maybe one from me while you're waiting, Lyle, and that's this whole question of the thought of people that are working from home. I know you covered this a little bit, but working from home and not particularly involved anymore with their coworkers, and then being cast back into the workforce. Is there any shift that you might have seen in your survey, or is that looked at all?
So we weren't able to look at that with our survey, just given that we only ran the first set of data in 2022. There is existing research out there. I'm not sure if it's among older adults specifically, but among the general population, showing that there have been some residual effects in the post-pandemic era, especially this idea of now working at home solo, that might be impacting social isolation and loneliness levels. But in terms of older adults in Canada specifically, yeah, I again unfortunately can't provide more detail on that.
Okay.
No other questions here, Randy. So
okay, then I guess we won't try and drag it out if people have exhausted what they want to ask. So let me again thank you so much, Natalie, for your presentation and response to the questions. We like you never really know when the questions come in where they may take us in these webinars that we do, but appreciate your responses to them, and it's amazing the amount of data that you've collected through this survey and the ability to synthesize it into some important points. Because I know often you get huge studies done, and then to try and boil it down into a workable presentation. I think you've done very well with that today. So on behalf of this group and our members, we certainly thank you for that. And so it's very good. Great job.
Thank you so much. It was a pleasure to get to share our findings with you folks today, and look forward to sharing any future analyses and reports we do with the data on this issue or others that are impacting seniors both in Saskatchewan and across the country.
Well, we have been back and forth in touch with you, I think through Harold's initiative to connect with the National Institute on Aging. And so I'm sure you're going to hear from us some more as we continue our journey and that. So as we
look forward to it.
okay, let me just shift gears a little bit. I think we want to also alert our members that this is, as I said at the outset, this is one of several webcasts that we plan to do over the next period of time. The ones that are coming forward should show up on your screen. We're looking at a presentation done on behalf of Group Medical Services, GMS, around the new care network that they launched March 1st. This is a shift away from Homewood Health, an organization that used to provide support and counseling services to members of the SRA. There's a new provider that has engaged with GMS, and we think it's important that we bring that information forward. So we're looking to try and put that together in the April timeframe. We don't have a date at this time, but that's our plan. You have expressed interest in wills and estates to us, and so we are looking to pull something together there, have some leads in terms of resources to bring that forward. That one and updates around Planera, the new name for what you likely remember as PIBA. And that, so they have moved, as you know, to a nonprofit status away from government, and shifted their name and shifted their brand and that. And so we're looking to ask them to come in and give us an update. I think you'll see the wills and estates and the Planera update probably into the fall, as opposed to trying to push it into the spring and into the early summer. In Saskatchewan, as we always know, once once the snow goes and people get interested in summer, there's an interest in summer and outdoors and gardening and agriculture and camping and most things related to family and working outside and doing things like that. So trying to push information forward sometimes at that time is not the most productive. The other thing I would mention to you is our annual general meeting is planned for May 23rd. We will be offering it as both an in-person meeting, and we also will have a virtual offer to go along with that. So if you are in the Regina region, watch for announcements as far as the location. We have not finalized that yet, but it will be May. We do know it will be May 23rd. And if you are further afield, as we know, we have members in many communities in Saskatchewan and in Western Canada. If you're further afield, we will be offering you a virtual option so you can come in and participate. This will be different than what we did, I think, 2 years ago, where we offered a in-person plus a YouTube viewing option. This suggestion this year that came from members was to also include the opportunity to provide everyone an ability to vote on the various motions that come forward. And so that's what we're working towards putting together. So feedback you provided from the previous version was, it was nice to view it, but we couldn't participate. And so we will have dealt with that as we put this forward. And so that will take place. And please watch for announcements and watch either for e-blasts from us or in announcements on our website in terms of specifics on location. I can tell you it will be 10 a.m. So May 23rd, 10 a.m. And so watch for that. Okay. One last check with you, Lyle, in terms of questions.
No other questions, just people thanking us, saying it was very interesting. So,
okay.
Right.
Well, that always helps.
Yes.
Well, then let me, it's 2:40 p.m. So we will begin to wrap it up here. So I would just like to, again, thank you, Natalie, for your presentation and certainly the information that you provided will help us in our planning, will help us beyond the Saskatchewan Retirees Association in our interrelationship with the Saskatchewan Seniors Mechanism. So this is for us, it's a joint win, and we appreciate very much the findings and your willingness to introduce us to the National Institute on Aging, so that we see some of your activities live, not just reading reports or picking up tidbits that might show up in the media from time to time. So very much appreciate the fact that you've been with us today. And to the members that participated, we always thank you. We can't do these things without you. And we know it's important that you choose to log in and help us through these processes. Once again, this presentation will be posted on YouTube. The link will be on our website in the next few days. It won't be there immediately, but it'll be there fairly quickly. And we'd ask you to stay logged in, if you will. There will be a post-event short survey, so we can receive some feedback from you. Sounds like Lyle said you provided some through the question box. So, but if you could help us with the short survey, we always look to the feedback from you to see how things went, what you thought was good, where you think we might be able to improve, as we're always interested in making sure our presentations are good quality and hit the mark as far as interest that you have. And lastly, just special thanks to the SRA board for your support, and especially to Harold and to Lyle for helping on camera with us today, on and off camera, I guess, with us today to bring this presentation to you. Again, to you, Natalie, thank you. And to Terry Scott and VoiceWorks, who helps our production on these presentations. We have chosen to make investments to make sure that we put together quality productions for members so that you get to see a good presentation and a good show, if you will. And so thanks so much. So I would just say, I know that we had a big snowstorm in this province, but spring is near. And so I would wish everybody the best, and we will see you very soon. So thanks so much, and bye-bye for now.